Hi guys! Welcome to my YouTube channel! I have one day off kaya I will spend it doing this vlog about the poem that I made last year, 2019, Pediatric Surgery Retreat Day, with the theme, Inspiring Better Health. So, I'm working here in Saudi Arabia for more than a decade, and I want to shout out to all the frontliners that I've worked with in healthcare institutions. And hindi lang dito sa hospital, not just only in this hospital, but this is my fourth hospital, one in the Philippines and three here in the kingdom. And I want to shout out to all those surgeons, anesthesiologists, and colleagues that I've met along the way. And speaking of this poem, Railway inspired me to give a clear picture of the journey of the patient going for surgery and during surgery and after surgery. So it's called the perioperative railway. Ta-da! See? Railway in the sense that the patient's journey is from station to station. So I highlighted ill in the railway because the patient needs medical treatment, or the patient has an ailment or something like that. So there are 11 stanzas that I made for this poem. I made this one because I have the passion in my heart working as an OR nurse, and I hope it will give you some sort of enlightenment para hindi po kayo masyadong anxious. Bakit po ako na hospital? Bakit po ganito ganyan? Ano po mangyayari na susunod? Parang ganun po. Everybody who's about to go to surgery is really anxious. That's why I want to share it with you through this poem, kung anong i-expect nyo somehow. Meron po akong mamimiss. Sorry po. If meron pong mga sorry din po. But the thing is, I will just give you basic thing to what to expect kung kayo po ay meron po karamdaman at kailangan po kayong operahan. Okay po. Let's start. So, first stanza, health issues arise, needs medical advice. Ask specialist about why, seeks information as guide. Isn't it that kapag po meron tayong nararamdaman, if we feel something bad and discomforts, we tend to seek medical attention. So yan, that's the first stanza. So that we will be guided by our doctors, health counselors, or health educators, ganun po. Then, admission is imminent, correct identifiers to present, history taking plus assessment to plan and to implement. During this process, we need to be honest because the doctors are not just asking questions for nothing. It's the basic things wherein he can base his decisions, his plans for the betterment of our health. So, yun po. So, the doctor has to know our educational background for them to give us the information or explanation that we deserve based on the level of understanding. You're not a medical practitioner and you're not familiar with anything that you need to know, the doctor has to adjust yung parang the level of your understanding. So, you would further learn and for you to have the clear picture of your health condition. Ganun po yun. We don't degrade here. We don't judge people's attainment, you know. So be proud po kung whatever you achieved in life, be proud of it. Taking plus assessment to plan and to implement. So history taking dito po ay yung mga na previous nyo na pong mga na-operahan kayo before, yung previously medical conditions that you have bronchial asthma, you have allergies, sabihin po ninyo lahat-lahat. And then next, medications are prescribed, lab works are stabilized, diagnostic exams are analyzed, consents are required. So if the patient needs medications immediately, such as for hypertension, sublingual, they can give it under the tongue para po but if you need urgent admission, they will give you through IV in ER, they will insert cannula, ganun po. Dalagyan po kayo ng swero para po kayo po ay mabigyang lunas agad-agad. And if you can be managed at home, pwede po kayong pauwiin with your prescription and medications. Home meds lang po, pwede po yun. But for this peri-operative railway, specific po ito sa patient na for surgery po. Kaya tuloy-tuloy po from admission. So, during admission, the patient is obliged to present proper identification. For us, you have the PhilHealth, PhilHealth IDs, or any government IDs. You're very important for you to have your health records at home, have your personal health records with you. By the time you want to go to the hospital or any clinics, you have your envelopes containing all the essential documents and evaluations that you have before. So, halongkatin po ninyo. Those are the recent reports only. But for those na you have already, or you are well, you've recovered, so you can throw that away and it's not updated, so you can throw it away. The ones that I'm pertaining is yung recent po. The recent results, lab works, don't throw it away. If you have, for example, if you went to the doctor, then you have your result, the doctor have seen it, still you need to keep that one if it's recent only or new results, okay? And then lab work. So while you're receiving your medications, you can have lab works or work out of your laboratories in the hospital. So your lab works are being stabilized in order for you to have fast recovery, especially the risk involved with the surgical interventions or your surgery. You need to have your hemoglobin, you have the clotting factor is very important. So in order for them not to have bleeding, those are the risks for surgery, bleeding, one of the factors that they consider. So consents, you need to give them informed consents. Informed consents meaning you are aware of the risk, the doctor was able to explain to you well, and you are satisfied, then that's it. Next stanza, anxiety and pain to expect, unsure about after effect of all risk and undesirable defect from surgical steps, side effect. Because although surgeries can cure us, can help us recover, but there would be some sort of side effects as they do the intervention. Those are the steps that are unavoidable, and the risk of that certain intervention. So the anxiety and the level of pain also of the patient is there. So that's why those are the factors that we take into consider in patients going for surgery. So surgery checklist is there in what we call as best care, which aims at safe care to all patients in healthcare. So here in Saudi, they have the best care here, which is a computer based system, and everything is there to protect the patient and the healthcare providers as well. So we have the surgery checklist, making sure that nothing is being missed. So that's the goal. The safety is the goal. Okay, the next stanza, every time we intervene, the proper hand hygiene, donning, doffing of PPE is certain to break infections chain. So there's a chain of infection, right? And so we are obliged, we must be responsible not to cause cross contamination between patients and the environment and our colleagues. So we should do proper hand hygiene, and in my previous vlogs I also did the hand hygiene and hand washing vlog about it, so better check the link below. So the next stanza is, what is so unique inside operating theater? Strict compliance to sterile technique is irrevocably basic. So this pertains to surgical conscience. So being an OR nurse and being into a surgical field, we should have our conscience, carry all the time. Nobody knows how you wash your hands well, how you scrub it, how you do it, how you did the procedure, something like that. The patient is helpless. Patient is under anesthesia, and we have that conscience not to harm him, even though he cannot see us, even though he is unconscious. So that's why I put this one on the seventh stanza, because this is something that is really important in this journey for the patient. Okay. Next one, intra-op surgical intervention with therapeutic communication among team members in action for one's health restoration. So even under stress, under anxiety, the doctors and the nurses tries to be communicating in a professional way They don't panic even though how stressful it is. Well, it depends on the personality, but somehow they try to manage their anxiety level by staying calm. So that's it. Interrupt with therapeutic communication. So everybody will work harmoniously. Will be, will be able to think, to decide. Will have the critical thinking works properly if the therapeutic communication is there. Okay. After all, these are being done for the restoration of the patient's health. Next one, complications may occur. Same is true with error, but with trainings procured, everyone's safety is assured. So, as we said before, because of anxiety, because of the risk involved and the pain that's being experienced by the patient, as well as the anxiety of the healthcare providers, and so they have these trainings or continuing education wherein they will be become more confident of what they need to do, how they should do things, especially in the stressful situation. So that is the stanza number 9. Okay. And stanza 10, recuperate with passion and effort. That's where the best nurse passion comes in. Provide family support, build proper rapport for ease and comfort. Before, personally, being a nurse, I would really love to talk to patients, to my patients, to the mother or parents of my patients, because they're the most stressed during those times of surgery, and it's a nice feeling to see them smile despite of that anxiety that they have. If you try, so we have to have rapport, not only to our patients but also to our colleagues. Wherever we go, it's the thing that we carry is ourselves. So if we can touch others' lives, then we should, for them to be able also to reflect the kindness that we give it to them, right? So the last one, perioperative journey can be dicey. Okay, so like a roller coaster ride. Alleviate suffering wholeheartedly. We must somehow, if we cannot remove the suffering of the patient, we can somehow lighten up how they feel difficult times. Render care with high quality. So we'll do the best that we can towards destination of recovery. So we will be arriving in a correct destination, which is full recovery. So that's it. And I'm proud of my poem, even though you'll find it corny or something, but was approved by my good manager and my DCN and AED. That's their signatures. But one thing I would like to share it with you, because all of us underwent these difficult situations, and somehow we seek some sort of outlet or assurance somehow that everything will turn out to be fine. So that's it. And one thing I want to share with you, while railway, I will show you now how. And now I will explain to you through an illustration why is it railway. So I have a railway here. Then this can be the clinic, or this can be a doctor in the clinic. Okay. Then the doctor in that clinic will tell the patient that you need to undergo operation. So the doctor will advise for an admission. So this bar, the bar in the railway, those are the steps that the processes that the patient will undergo. So he will go to the hospital, he will have his lab works done, anything, IV, putting on the suero, the IV, the medications, then they will have also taken blood samples and all. Then after that, the patient will have patient will go to his room, or it depends. The patient might need a private room or in the ward or in the ICU, something like that, based on the assessment or investigation being done here. And after that, once the patient is stabilized, again this one here, these are the, for example, if there's a discrepancy or alterations in the lab works of the patient, here, then it will continue here. When the patient is at home, they will give medications, they will further investigate, like they will do diagnostic procedures, they will do ultrasound, they will do biopsy and all like that. Ultrasound guided biopsy, for example. And then if for example, if malignant and the patient needs to have mastectomy or something, then it will be opted to OR. Okay, we'll go to OR. In OR, that is the steps. They will have the procedures done, the blood transfusion, anesthesia, something like that. So this railway is very important or essential in order for the patient to have a smooth ride or a smooth peri-operative journey. So yun po yung aking reason why I have this peri-operative railway presentation. Then after that, patient will go, after OR, will go to recovery room for a while, if the patient will be going back to his room, or it's either he will go ICU. Okay? If the patient needs to be monitored closely, ICU. It depends on the anesthesia, okay? But if the patient will go back to the room, he or she will stay in the recovery room for a few minutes, and then once stable, will go back to his room. Here, see? Shortcut. He will do the shortcut like that. And eventually, if the patient is well from the room, will be discharged home. So that's the representation of the railway. So if you guys who are watching and you're having these difficult times where you need to decide for yourselves, think and be positive about it. No, life itself is a roller coaster ride, and being in a surgery situation, or you will undergo surgery situation, also a train ride. So that's how it works. So God bless, and I hope you have learned something. Please don't forget to subscribe and share this video for your relatives or friends or anyone whom you know that they might need surgery soon. This will help them cope with the stress and anxiety that they feel during these difficult times. Everybody's afraid to undergo any surgeries, and I hope this video will make them feel a little bit better in order for them to cope the stressful situation that they have. And coping means recovery itself, because if they know how to cope, if they can be stronger enough, they can help themselves back in a good state of health. Thank you for watching, and see you on my next vlog. Don't forget to comment and subscribe if anything that you want me to do a segment or anything. Thank you guys. Thanks for watching. Buzz Nurse Passion at your service.